In this video, we will learn how ECG changes are related with the coronary artery blockage, and with a few real-life examples with coronary angiography report. We will learn this in 4 simple steps: ECG changes, coronary artery involvement, real-life coronary angiography, and result after coronary angioplasty. Let's start with our first example. In this ECG, we can see the ST elevation in lid V2, V3, V4, V5, and V6. This is the ECG of anterior wall ST elevation myocardial infarction, and when ECG has anterior wall STEMI, there is more likely involvement of left anterior descending coronary artery, which we call LAD, and this is the live action example of LAD blockage in coronary angiography, which needs treatment of coronary angioplasty, and this is how it will look after coronary angioplasty. Example number 2. In this ECG, we can see the ST elevation in lid 2, 3, and AVF. This is the ECG of inferior wall ST elevation myocardial infarction, and when ECG has inferior wall STEMI, there is more likely involvement of right coronary artery, which we call RCA, and this is the example of RCA blockage in coronary angiography, which needs treatment of coronary angioplasty, and this is how it will look after coronary angioplasty. Example number 3. In this ECG, we can see the ST depression in lid V2, V3, V4, and V5. This is the ECG of posterior wall ST elevation myocardial infarction, and when ECG has posterior wall STEMI, there is more likely involvement of left circumflex coronary artery, which we call LCX. And this is the example of LCX blockage in coronary angiography, which needs treatment of coronary angioplasty, and this is how it will look after coronary angioplasty. Example number 4. In this ECG, we can see the ST elevation in lid 1, AVL, V5, and V6. This is the ECG of lateral wall ST elevation myocardial infarction, and when ECG has lateral wall STEMI, there is more likely involvement of diagonal coronary artery, which is a branch of LAD, which we call D1. And this is the example of D1 blockage in coronary angiography, which needs treatment of coronary angioplasty, and this is how it will look after coronary angioplasty. Example number 5. In this ECG, we can see the ST elevation in lid AVR and V1, and when ECG has ST elevation in lid AVR, there is more likely involvement of left main coronary artery, which we call LMCA, and this is the example of LMCA blockage in coronary angiography, which needs treatment of coronary angioplasty, and this is how it will look after coronary angioplasty. There are some of exceptions present as well, which is due to the anatomical variant of coronary arteries. In majority of the cases, RCA is dominant to LCX, which means RCA supplies the blood to the larger area of the heart in comparison to LCX. But in some cases, LCX is dominant to RCA. In such cases, when ECG is suggestive of inferior wall STEMI, it is highly likely that LCX having blockage instead of RCA. And when ECG is suggestive of lateral wall STEMI, it is highly likely that the branch of LCX having blockage instead of D1. This branch of LCX is called obtuse marginal, or OM1. Thank you all for watching the video till the end. We will meet you in the next video. Until then, please subscribe to the channel and stay tuned.